Should I start now? Bismillahirrahmanirrahim. Let's start today's presentation with the quote. The greatest threat to our planet is the belief that someone else will save it. Today's topic of presentation is leptospirosis. I am Dr. Daud from Community Medicine Department. In today's presentation, we will cover introduction about leptospirosis, epidemiological determinants, clinical manifestations, level of prevention, and recent advances about leptospirosis. By the end of this session, we will be able to understand about the mode of transmission of leptospirosis and possible ways and means of its prevention and national and global updates. Let's start with the introduction. Leptospirosis is a zoonotic disease with epidemic potential, especially after heavy rainfall, and is caused by a bacterium called Leptospira. Leptospira interrogans is a pathogenic to humans and animals with more than 200 serological variants. Humans usually acquire leptospirosis through direct contact with the urine of infected animals or a urine-contaminated environment. Human-to-human transmission occurs only very rarely. As far as its epidemiology is concerned, it's occurs worldwide, but is endemic in mainly countries with humid subtropical and tropical climates. Estimates indicate that there are more than 500,000 cases each year worldwide. The disease is epidemic potential after heavy rainfall, as I said earlier, or flooding, or hurricane, or tornado, or condition like this. And cases have been reported in most of the countries like Brazil, Nicaragua, Guyana, and several other Latin American countries. The majority of reported cases have severe manifestations for which mortality is greater than 10%. I have underlined the reported cases because most of the cases go undiagnosed. The number of human cases is not known precisely due to undiagnosed, or underdiagnosed, or misdiagnosed. And as I said, it's associated with flood and hurricanes. Leptospirosis can also be an occupational hazard for people who work outdoor with animals such as rice and sugarcane field workers, farmers, sewer workers, veterinarian, dairy workers, military personals, and it is also recreational hazard to those who swim or wade in the contaminated water. Leptospirosis is a problem of human and veterinary public health. Numerous Leptospira strains can establish infection within a variety of animal hosts that includes rodents, livestock, and other domestic animals, while humans serve as incidental host. Wild and domestic animal in carrier state may shed leptospirosis intermittently for many years or even for lifetime period. This is the pictorial presentation of a good example of animal-human ecosystem interface. This shows the blood, hurricane, tornado, or rainfall. That is the, the preliminary condition for its epidemic. As far as the agent is concerned, is a corkscrew-shaped bacteria, spirochete, thin and light motile. Only strain of Leptospira interrogans are pathogenic, visible by dark field illumination and silver staining. 21 species identified, 13 species detected in human cases. The source of infection is urine of infected animal, entire lifetime in case of rodents. Animal reservoirs are wild and domestic, especially rodents, rat, mice, moles, particularly Arnorvegicus and musculus. Cattle, sheep, goats, buffalo, pig, horses to grazing, and also dogs. Humans are the accidental host. Children acquire infection from dogs more frequently. And occupation, as I said earlier, veterinarian, slaughterhouse workers, farmers, sewer maintenance workers, waste disposal facility workers, and people who work in derelict buildings, rovers, caretakers and goniacists also sometimes are prone to develop this sort of problem. And survive immunity is specific immunity that they. As far as the environment is concerned, leptospira is a urine survive. Shed in the urine, survive for weeks in soil and water. High level of environmental contamination where carrier animals frequently urinate, where poor housing, limited water supply, or inadequate waste disposal are the predisposing conditions for its transmission. Transmission is through direct contact, skin abrasion, or intact mucous membrane, or indirect contact through broken skin with contaminated soil, water, or ingestion of the contaminated food or water. It may spread through a droplet infection like breathing, air polluted with droplets of urine, like while milking cattle. Pathophysiology, the sequelae of events goes like this. The infection, from infection, leptospirosis appear in the blood, invade the cell tissue, particularly the liver and kidney, and from there, they clear from the body by the immune system. They may settle in the convoluted tubules of the kidney and shed in the urine for weeks or months, or may also subsequently may be cleared from the kidney and other organs, but may persist in the eyes for much longer. Where they are lodged, they produce endotoxin and attach to endothelial cells, capillary, where they cause capillary vasculitis, uh, ending up the endothelial necrosis and lymphocytic infiltration. Vasculitis and leakage leads to petechia, intraparenchymal bleeding, and bleeding along serosa and mucosa. Loss of fluid in the third space, hypovolemic shock and vascular collapse may result. Humans react to an infection by producing specific anti-leptospira antibodies. Seroconversion as early as 5 to 7 days after the onset of disease, sometimes only after 10 days or longer. IgM appears sometime somewhat earlier than the IgG, generally remains detectable for months or even years, but at low titer. Broadly speaking, there are two clinical types. You can say that as the name indicates, ecteric and anicteric. Ecteric means that it's a jaundice form, which is very severe form, but it's a rare disease. It's, predominantly the anicteric form. Anicteric form is in about 90% of cases with mild cases of fever, myalgia, while ecteric form is mainly associated with the jaundice and involvement of other organs. It's about 5 to 10%. These are the um, picture of the human body showing the organs which may be involved after a sequelae of events, what the leptospirosis can cause to the body. The other name for this, the Wales disease, which may cause the uveitis, jaundice, epistaxis, hematemesis, pericarditis, myocarditis, hepatomegaly, renal failure, transit macular rash, purpura bruising on the skin. While the pulmonary manifestation may appear like hemoptysis, pulmonary hemorrhage, or acute respiratory distress syndrome. Myositis may also be one of the manifestation of the bacteremic leptospirosis, and diarrhea, vomiting, conjunctivitis, or headache or photophobia, also the manifestation of this, and along with the aseptic meningitis. All these are the clinical syndromes of clinical manifestations of leptospirosis. This is how it goes in the environment from human to animal and animal to environment, and the asymptomatic rodents, how they play their role in the environment. The diagnosis, we can confirm the diagnosis from a clinical specimen or fourfold or greater increase in leptospira agglutinin titer between acute and convalescent phase, serum specimen studied at the same laboratory, or demonstration of leptospira in tissue by direct immunofluorescence. Or the other method is leptospira agglutinin titer of later more than 800 by microscopy agglutination test in one or more serum specimen. Or we can have detection of pathogenic leptospira DNA, for example, the PCR from a clinical specimen. Treatment is drug of choice is a penicillin. The other drugs like ampicillin, amoxicillin, other severe cases, cefotaxime, ceftriaxone, or these antibiotics may be given. That salt and water solution infusion, the part of treatment, dialysis in severe cases. Organ-specific care and treatment are essential in case of renal, liver, or heart involvement. Risk exposure, as we discussed earlier, the risk of and the occupations which are more prone to develop these sort of, problems are the farmer, mine workers, sewer workers, slaughterhouse worker, veterinarian, animal caretaker, fish worker, dairy farmer, military persons. In addition, incidence of leptospirosis infection may occur in urban children is also appearing to be increasing globally. Clinical diagnosis, typically the disease presents in four forms. Firstly, is maybe mild influenza-like flu-like symptoms, or the other presentation may be the Wales syndrome, characterized by jaundice, renal failure, hemorrhage, and myocarditis with arrhythmias, or may it present with meningitis, meningoencephalitis, or lastly, the pulmonary hemorrhage with respiratory failure. Of the many symptoms, the most common clinical features of leptospirosis include fever, headache, myalgia, particularly in the calf muscle, conjunctival suffocations, sufficient jaundice, general malaise, and in addition to other symptoms and signs. Clinical diagnosis, incubation period 5 to 14 days with the range of 2 to 30 days. Symptom easily confused with the other common diseases and tropics such as dengue and other hemorrhagic fever. Diagnosis of leptospirosis should be considered in any patient presenting with an abrupt onset of fever, chills, conjunctival confusion, headache, myalgia, and jaundice. History of occupational or recreational exposure to infected animal or to environment potentially contaminated with animal urine. Differential diagnosis is a wide spectrum of diseases to which this leptospirosis can mimic, and you have to have a consideration of the following diseases while diagnosing the leptospirosis, like influenza, dengue hemorrhagic fever, yellow fever, other hemorrhagic fever, rickettsiosis, brucellosis, malaria, pyelonephritis, aseptic meningitis, chemical poisoning, food poisoning, typhoid fever, enteric fever, viral hepatitis, pyrexia of unknown origin, primary HIV seroconversion, Legionnaires disease, toxoplasmosis, infectious mononucleosis, or pharyngitis. Prevention, the main focus is just to avoid the water or mud that may be contaminated with the animal urine, in addition to rats, potential sources which are the potential source include wide range of wild and domestic animals. While when you go for a water sports, look for the posted signs and avoid swallowing water when swimming in the lakes or river. Wait until the cuts and scrapes heal, or cover them with the bandages with before submerging in possibly contaminated water. Wash cuts, scraps, and shower after possible exposure. Avoid wading in flood water. Wear protective shoes and clothing. Reduce rodent population whenever possible. There is no widely available vaccine for this problem. Here is the update uh, about leptospirosis. This is a review article. It published in 2020. What it says that they have summed up that it's a neglected re-emerging disease of global public health importance in human and animals due to negligence and rapid unplanned urbanization and poor sanitation. Leptospirosis emerges as a leading cause of acute febrile illness in many of the developing countries. Every individual has a risk of getting an infection, and domestic and wild animal carry leptospirosis at risk. Population varies from, as we discussed earlier, healthcare professional, animal caretaker, farmer, agriculture worker, fisherman, rodent catcher, water sports people, national disaster response force personnel, people who volunteer, rescue operation in flood affected areas, or sanitary workers or sewage workers. That's another mini review of the disease with the global prevalence. But they have come out with the conclusion that's a very vast and its ranges from self-limitation of non-fatal infection to highly mortal respiratory and renal failure. Well, disease associated with severe leptospirosis is characterized by jaundice, renal failure, or hemorrhage. This condition is so much alarming that clinical suspicion is sufficient for empirical therapy. The gold standard is microscopic agglutination test, though serological studies are widely conducted for diagnostic purpose. Again, a systematic review of leptospirosis worldwide of about the outbreaks between 1970 to 2012. And they identified 318 outbreaks. Most outbreaks were reported in Latin America and Caribbean region, followed by South of Asia and North America. Most outbreaks were located in tropical and subtropical ecoregions. This is a study from Pakistan and conducted in 2018. Seroprevalence and risk factor analysis of human leptospirosis in district climate region of Pakistan. In that study, the overall seroprevalence in Pakistan was studied. It was about 40%, and statistically significant difference was observed in leptospiral seropositivity. Rawalpindi was the highest seroprevalence with 50%, followed by Lahore about 44 and Bahawalpur about 27%. These are the references of the presentation. You can access these articles, what I have mentioned, particularly the first three one. Now the MCQs. All of the following statements about leptospirosis are true except
B.
C.
Let's see. Antibodies usually detectable after the first week, about after 10 days. So C, the correct answer. All the others, the statement here mentioned, these are true. But the C is not true. Which of the following infectious disease is transmitted through rat?
Leptospirosis.
That's self-explained. None of the other diseases mentioned here is transmitted through rat. Which of the following statement about leptospirosis is true?
Alpha.
A.
Let's say. Drug of choice.
D. Penicillin.
Which of the following organism can cause acalculous cholecystitis?
C.
C. The most consistent pathogenic finding in leptospirosis are all except.
C.
Yes, it's C. The rest of the statements are true. It causes vasculitis, endothelial edema, lymphocytic infiltration, and necrosis, but there are no giant cells in there. Which of these is not an alternative name for the leptospirosis?
D.
Cattle fever.
D.
What's
B.
cattle fever? It's not the, yes, it's correct, but the rest of the thing, these are the other names for this disease. Leptospirosis is maintained in infected animal by
B. C.
chronic infection of the renal tubules. It resides there, and it's created in urine even for the lifetime infected animal. Which of these statements is not true?
C.
That's
C.
B. That's the B. You can remember the shape. These are not the straight spirals. These are the spiral ones. These are not the straight ones. That's correct answer is B. This is the key. And thank you very much.
Thank you very much for the wonderful presentation. As we all know that leptospirosis is an bacterial infection that affects both human and animals. Humans become infected through direct contact with infected urine or urine contaminated environment. Bacteria enters through cuts in skin and mucous membrane. It is a zoonotic disease which has an epidemic potential, particularly after birth. Preventive strategies include wearing protective clothing for people who are at risk and avoidance of swimming in contaminated water. For control of this disease in animals, vaccination is available for animals, and we can also control the rodents. There is a global leptospirosis environmental action network, as leptospirosis is a global threat for humans and animals. And this program or project focuses on prevention, early detection, and control of this disease. My question from the class is that what happens if this disease occurs in pregnancy?
It can lead to interuterine growth restriction, fetal death, low birth weight babies if pregnancy contains abortion.
Yes, it can cause increased incidence of fetal death and abortion.
Any
Any
question from
question
the
from
class?
the class?
Is there any
Thank
screening
you.
test available for leptospirosis?
Screening test. You mean the rapid test available for that? The diagnostic test I mentioned there, you can go through the gold standard. Pardon?
Microagglutination.
Yeah, and this is the diagnosis, the gold standard. You can eventually buy the, I mean the PCR, but you can, the MAT test, the agglutination test, it is more than 800 by microscopy agglutination test in one or more serum sample.